Okay, I'm Dr. William O'Connor, and this is a patient of mine who had knee pain. Tell me a little bit about your knee pain and what we came to as a diagnosis, and how we decided that was what was the cause of your knee pain.
Well, the knee pain started about a year ago, and the whole knee and the leg, part of my leg below, swelled. And then as it went down, when I came to you, you said just start exercising, doing that little circle thing on my leg, and I kept doing that while I was working, as I could work in the office, and as I move around, and I just kept it up. And at night, I would hook my foot behind and bring my knees up, and I could feel it, and it got better and better. And one evening, I could feel it pop. It really felt good. So since then, I've been able to climb stairs with minimal pain. And each time I go now, it gets better and better, and I just walk upstairs like I never did before.
Did you ever injure your knee?
Never.
That you recall, anyway?
Nope. Very athletic, always busy.
Now, a year ago when your knee started bothering you, you pointed to a spot that was especially painful.
Right here, yeah.
And that we decided, or I diagnosed as being an inflammation of the medial collateral ligament, because that little piece was making a fulcrum and being stretched beyond its limits, and caused microscopic tears of the collagen fibers and an inflammation set up. Did that go away once that pop occurred and you...
It really diminished a lot. It felt really good after that. And I still have a bit of pain, but every day I keep
Did you ever use the Band-Aid trick with
No, I didn't use the Band-Aid.
Advil? Because that will get into that. That'll reach that. So I'd recommend you do that. And you were doing my exercises that I described, where you shake your leg and then you bring it up and passively lift it into a flexion beyond that which you would do actively.
Right.
And so that's what you were doing in bed when it clicked.
Yeah.
And then after that, it got remarkably better.
It started getting better and better, and it just got almost diminished now. I can climb stairs. Before putting weight on that would hurt too bad. Right. Yeah. Well, that's my technique that I developed to re-centralize a displaced piece of medial meniscus. And so at some point in your life you did that, and you pulled out the piece, and it probably went in way back then, and you've gone a long time without a problem, and then you did the wrong move and it pulled it out again. And then doing the right moves, if it goes out spontaneously, like you didn't get in an auto accident and broke, it just happened. Well, if it goes out spontaneously, that usually means it can go back in spontaneously if you just know the right move. Right.
So you're a beneficiary of that.
I used to kind of almost like a hop when I go upstairs. Now I just walk right up the stairs.
Cool. Yeah. All right.